Okay friends, let's continue our dermatology high yield points. Okay, what is the difference between purpura and arithema? Purpura on dioscopy doesn't lose its color background, so this is unaltered. On other hand, arithema, it loses its background color, it disappears, so redness will disappear in arithema on dioscopy. Next one, Molluscum Cantadiosam. Here we see the multiple pearly white umbilicated lesions with a dimple at the center, so center is depressed. This is caused by pox virus. Now how it spreads? It spreads in common swimming pool, and sometimes sexually transmission is also seen. But palm and soles are spared in Molluscum Cantadiosam. Next one. So this image is the toxic epidermal necrolysis or Steven-Johnson syndrome. It can be caused, so triggering agent can be some drugs. In that, allopurinol, an acid of oxycam containing oxycam, anti-epileptic drugs, phenobarbital, phenytoin, carbamazepine, lamotrigine, and some antibiotics like cephalosporin, penicillin, and sulfamethoxazole. All these can be the trigger of toxic epidermal necrolysis or SJS. Sometimes, like in children, infection is the cause. Notorious one is Mycobacterium pneumoniae. Next is the monitoring of leprosy. So we have two type of leprosy, paucibacillary and multibacillary leprosy. Paucibacillary leprosy, it has to be followed till 2 years post treatment, and multibacillary leprosy till 5 years post complete treatment. Okay, next one. So what is this? This half and half nail. So distal half of nail is here more pinkish, and proximal is whitish. So this is known as Lindsay nail or half and half nail. It is the rare finding but very specific to renal failure. Next. So pressure point, it is showing some lesions. This is the chronic urticaria, also known as dermographism. Okay, most common type of inducible urticaria is a chronic urticaria. So urticaria is produced from pressure and trauma. This is known as chronic urticaria. Next one, Wood-Slam's examination and the correlated conditions. So in case of erythrasma, coral pink fluorescence will be seen. Pityriasis versicolor, faint yellow. Pseudomonas, green. Porphyria, red or pink. Vitiligo, ivory or milk white. Okay, next one. Here we see Microstomia, small mouth, mask-like face, and the discoloration of this finger, Raynaud phenomenon. So this is the condition of scleroderma, and also we have finding in the patient So there is the digit ulcer. Digit ulcer can be seen in later diseases. And on the knuckles, bony prominence, we can see vasculopathic ulcer in serious cases. Okay, female to male predisposition. Female to male, it is in 4:1. Okay, it is also associated with this scleroderma patient can have GERD, pulmonary fibrosis, carpal tunnel syndrome, and loss of sweat gland. All these can be found in scleroderma. Okay, next one. What is this? So this is pregnant lady. So most common site of gestational pemphigoid is around umbilicus. Next one, the differences between chromoblastomycosis and sporotrichosis. So both are fungal infection to skin. So here is the, in chromoblastomycosis it is the pigmented fungi. Other hand, sporotrichosis is dimorphic fungi. Chromoblastomycosis, two species, Phyalophora and Fonsesia. In dimorphic fungi of sporotrichosis, Sporotrichosis is noted. Okay, so presentation in this chromoblastomycosis is a cauliflower like growth at site of prick, cauliflower like growth. And in histopathology image, copper penny body or medullary bodies or sclerotic bodies, all are same, can be found. This condition is very difficult to cure. So treatment is itraconazole and surgery like cryosurgery. What about the sporotrichosis caused by dimorphic fungi, Sporotrichosis, and it has in histopathology asteroid body can be seen. So it is present as a linear chain of ulceration along lymphatics, and Sporotrichosis looks itself just like this image. Okay. So thank you very much.